Hi, I am Dr. Raghav Malik, consultant, Cataract, Refractive and Cornea Surgical Sciences at Center for Sight. So many times I get this question that during LASIK or refractive surgery, can the retina get affected? So first let's start with knowing what the retina actually is. Jaise, like we have the body has a mind, right? Similarly, the retina is the brain of the eyes. So the eyes have a network of millions of nerve fibers which together collate and fight and make the retina that actually turns into an optic nerve that connects your eyes to the brain. So now we know that the retina is the brain of the eye. So of course protecting the brain is very important. So we need to know that whether the refractive surgery can actually affect the retina or the brain of the eye. So yes, there is a chance, but we need to know what exactly is the science behind it. So what happens is, whenever we want to plan for a refractive surgery, we have to attach a laser machine to the eye, which actually does put some pressure on it. So in order to protect the retina before the surgery, we have to do some tests and need to know how the health of the retina is. So whenever you're going for a LASIK examination, your ophthalmologist will ask you to do a number of tests, and one of the tests will include a retina examination where dilating drops will be put in your eyes and we will do a proper retina checkup through an instrument known as indirect ophthalmoscopy. With that, we will see the extreme periphery of the retina, the part of the eye which we cannot see with this slit lamp examination. We will see with the indirect ophthalmoscope, and then we will see if there are any weaknesses or any breaks in that retina. So yes, if you are undergoing a LASIK and there are some reports that yes, because of the increased suction on the eye because of the laser machine, there can be certain changes on the retina. So in order to prevent that, we have to go and do a pre-operative proper checkup of the retina, and we need to know that the retina is actually healthy. If the retina is healthy, then there is no issue whatsoever and there will be no damage to the eye or the retina, leading to no chances of blindness. But if in the pre-operative examination you are told by your ophthalmologist that there are certain breaks in the retina, something known as a lattice degeneration or a hole or a break, so all these retinal pathologies have to be treated before the LASIK or the refractive surgery, which is very, very important. So therefore, it is very important to get a thorough retina evaluation prior to the surgery. And once a retina evaluation is done, we need to know whether there is any weakness in the retina. If there is no weakness, nothing to worry about. But if there are any weaknesses in the retina, those have to be lasered, or those will be told to you by your retina consultant what to do about them before the refractive surgery. But on the other hand, there are certain types of refractive surgeries like a PRK or an Epi-Contoura or a smart surface. All these procedures involve no suction. That means that when the eye goes under the laser, there is no machine that is holding the laser to the eye. Because of that, there will be no suction on the eye itself. So these procedures have 0 to nil risk of any retinal complications. So just to summarize, very important to get your retina tested before the surgery, and if there is any weakness in the retina, that has to be taken care of very well prior to the procedure.
Follow Planet LASIK and post your queries to get answers from the experts.